Hi, I'm Dr. Andrew Pieri, and welcome to episode 2 of my podcast and YouTube series. Today's topic is timely because it's in the news right now, and it has to do with my patients asking, what can I do to support my immune system to help prevent COVID? Regardless of how you feel about vaccines, I'm going to be talking about things that you can do in addition to all of the things that you're supposed to be doing to help prevent COVID or to help reduce and minimize its symptoms in case you do catch it. Let's face it, nobody wants to catch COVID, nobody wants to get really sick with it. And there's this whole thing of a bunch of people don't get very sick from it, so maybe I'll be one of those. Well, let's increase your chance of being one of those. So first thing, after the vaccination, then there's do all the things that you were still supposed to be doing before. So keep your social distancing, wash your hands, use common sense. Try to avoid all of your contact potentially with COVID. So that goes without saying. Next are a few basics, and these are all going to be their own topics for new podcasts. And it's just basic self-care. Good diet. Make sure you're eating well. Number 2, sleep. Get adequate sleep. Very, very good for your immune system. Number 3, stress reduction. Whether it's meditation or prayer, some form of a self-help app that you're doing, but something to make you feel calmer. Now what I'm going to get into is some supplements that are easy to find, fairly inexpensive to take, that are going to help bolster your immune system and keep you from getting that severe case of COVID that everyone really fears getting. Nutrient number 1, the thing that you can get in the health food stores, everybody gets it in citrus fruits, vitamin C. So vitamin C is known as an antioxidant. So oxidative damage is what causes problems and inflammation to happen in our body, whether it's from trauma or from infection or from cancer. All these things cause oxidative damage, and vitamin C is one of our main defenses against that. And especially with COVID, which gets this what they call cytokine storm, where all of your inflammatory hormones in your body go berserk and start causing this inflammation, vitamin C is going to be really important. And in fact, studies have shown that your vitamin C requirements go way up with COVID. So make sure you're taking it, and if you do get diagnosed with it, take larger amounts of it. If you take too much vitamin C, main side effect you're going to get, loose bowel movements. But you can probably cope with that. My second recommendation, and I can't recommend this one more highly, is vitamin D. Vitamin D isn't even really a vitamin. I'll talk about that more in the other episode. It's actually kind of a hormone. But anyway, vitamin D, why do we need it for COVID? Well, it stimulates the production of something on our white blood cells called Tolllike receptors. And they're these little sort of spiky things that stick out of your white blood cells, and they kind of act like the spines on like burrs when you're walking through the forest or through brush, and they stick to your clothing. So when you've got good levels of vitamin D, you get all kinds of little Toll-like receptors that will stick to nasties like the COVID virus. Helps you get on top of it faster. So again, there are studies showing that low vitamin D is linked to easier contact with COVID, so you're going to catch it easier and you're going to have potentially a worse case of COVID. And Health Canada says that the what's called UL, or upper limit of vitamin D that you can safely take without worrying about overdosing, is 4,000 international units. A lot of people say, well, I heard it's only 1,000. That is the minimum requirement. Minimum. In Canada, we don't get enough sun exposure. We live in a very northern climate. Even if we get sun exposure, we can't make vitamin D here between the months of about September to maybe April or May. The third nutrient that's very important, and it's been shown to be low in people who have more severe cases of COVID, is zinc. Zinc has some effects on inhibiting viral growth within cells, so it'll just slow the thing down. Even if you get infected, it's going to slow the COVID down and give your immune system a chance to get on top of it. Anything you can do to make the virus replicate more slowly so that you can get ahead of it instead of it getting ahead of you. The next nutrient that I'm going to mention to you is something called N-acetylcysteine, or NAC, which is in protein type foods, especially in ones like dairy. You can get it in some forms of whey proteins, but most of the time it's been denatured and it's not going to work well for you. What does NAC do? Well, 2 molecules of NAC combine in your liver to form something called glutathione, which is the master antioxidant. It's super good for detoxing in the liver to provide antioxidant benefit, and it can also recycle your other antioxidants. So when vitamin C that's been used up, what we call oxidized, it can put it back in what we call its reduced form, ready to use again when it comes in contact with glutathione. So super important thing to build up in our system, high levels of glutathione, and that you can get from something called NAC. One last one that I'm going to mention that you can throw in with those other ones is something called quercetin. And quercetin is what's called a bioflavonoid. It's present in a lot of plants, and it acts almost like a natural antihistamine. So it has a bit of almost an anti-inflammatory effect. So when you get that cytokine storm that they talk about with COVID, it's one of those things that can help just sort of keep things calm in your system so that it doesn't go overboard and cause all those bucket loads of inflammation. So there's some tips for you for COVID-19, some nutrients that you can take, some supplements that can help you keep your immune system as healthy and ready as possible. Now, for a product endorsement, if you want the best amount of glutathione production in your body from probably one of the best products out there that has what's called bonded N-acetylcysteines or bonded cysteine. It's actually a product that was developed right here in Canada at McGill University, and it's something called Immunocal. It's actually in Doctor's Blue Book back in the old days when we had that blue book on our desk called the CPS, or Compendium of Pharmaceutical Specialties. Well, Immunocal is actually listed in there as a glutathione booster. It's something that can actually raise those levels in our blood. So that wraps up our episode for today. I hope you found this information enlightening and hopefully will be useful to you in your pursuit of health. Hoping to hear from you to get some feedback on this episode or for suggestions for future episodes. See you soon.